A recent study that we did in a group of obese children who had been shown to have heart disease. So we know that obesity is an epidemic now in America, and 1 in 5 children are affected. And also obesity is associated with premature death. So right now there's no study who has comprehensively evaluated the changes in their heart and the function of the heart. So we want to know, we want to do a comprehensive study to evaluate the prevalence and severity of heart disease in obese children. We are looking at the age group between 8 and 18. Average age is about 12. Obesity in children is actually defined differently from adults. We define obesity as beyond 95th percentile according to the Center for Disease Control growth chart. I think it's important to note that not all the obese children in our study have heart disease. It could be because that some of the children are obese for longer periods, but we don't know exactly why, and that's part of the question that we try to answer as well. And also, this is a preliminary study with only 40 kids included, so we hope to do a larger study to confirm our findings in the future. We found that obese children have increased weight of their heart as well as thickened heart wall. And then in a subgroup of these children, they even have impaired function, like the heart's pumping ability is impaired. I think the most helpful thing to do is prevention instead of treatment. So first of all, parents need to help children to maintain a healthy weight. And then as for treatment, it's a very difficult group of children to treat for sure. We are currently doing a study to see if there are any relationship between like pre-diabetes and heart disease associated with obesity. So that could be a treatment target in this population. So there are several steps that we are trying to do. First is we want to see if there are any treatable factors such as high blood pressure or pre-diabetes that we can target. And then we are also doing a longitudinal study to see the time course of the development of heart disease in obese children. For example, like how fast does it, how soon, how early does it develop? Or how fast does it progress? Does it stay stable for a while, or does it decline pretty quickly? We are trying to answer all these questions in a larger and longitudinal study of about 200 children at Geisinger.